Well, welcome everyone. Thank you for coming this afternoon. I know, taking time out of your life, it can be challenging to do, but there's a lot of really good information at this talk, so I'm glad that you came. My name is Megan Marco. I'm the owner and director of Stonington Natural Health Center. I'm a licensed acupuncturist and doctor of acupuncture, and Stonington Natural Health Center, Stonington Natural Health Center provides holistic health care for the whole family. We treat from babies to elders at any stage in your life. And I would like to help you have your dreams come true. I have been helping people with fertility for probably since the beginning of my practice, so since 2000, and it really became a passion for me when I had my own fertility issues, and I wanted to figure them out. And in the process of doing that, I just dove head on into learning about fertility and pregnancy. So my background is in Western sciences. I started off as a biology major at Bowdoin College, and along the way switched to neuroscience and got really interested in the mind-body connection. I was pre-med, got very interested in alternative medicine, holistic medicine, and shifted to going into a master's in acupuncture and oriental medicine. I moved out to Portland, Oregon for my master's, and that was a 4-year training. And then had a practice in Portland, Oregon for 4 years. And then in 2004, moved back east and set up Stonington Natural Health Center December 1st, 2005. My advanced training in fertility was, well, we studied it a lot in acupuncture school, but then I took a whole winter of seminars up in Boston with Lynn Swerda, who is a specialist in this. Then I continued with having trouble, so I wanted to keep studying, and I went to China for a month of October of 2007 and studied with Dr. Huang, studying the herbal formulas even more in depth, because that's not always incorporated in, and as you can see from the display here, we use them, and we use them really effectively because they really help to shift the biochemistry. And we'll talk about that more in a little bit. So with my background, just a really brief summary, I've had multiple miscarriages. I know the emotions that go with that. I've had difficulty conceiving too. I know the frustration with that, and that's a big part of fertility that often people don't think about, is the hopes and the dreams that are involved and the emotions that are involved, and often people don't outwardly talk about that in public. It's rare. I have one patient who does, and I'm really amazed by that because I was never able to. I kind of kept it inside. And I find that to be more common, and the emotions involved with seeing other people pregnant when you wish that you're pregnant, and family members asking, "Are you pregnant yet?" And then you're just kind of joking around. And you're like, you realize you're almost making me cry by asking that question. So there's a lot of things involved with what fertility and pregnancy that I work with. I help with recovery after miscarriages too. People sometimes don't think about that also. So in that I have been through this, I have a lot of empathy, which I really appreciate, to be able to have that so that I know where people are coming from. And so often, just a little piece about that is that so often in life we think, you can just plan out your life, and this is the first time often that a woman can feel like, oh my gosh, I thought I could just have a baby, or I was always trying not to get pregnant, and now I want to get pregnant, and why isn't it just happening? So so that's something also that I empathize with. So what we work on is getting things to be ideal. So we look at, well, why isn't this happening? And every person is different. And so by going through the health history, look at what is happening energetically. And there's never any judgment in Chinese medicine, which is something I really appreciate. It's just that the energy needs to be shifted. And that is the basis of Chinese medicine, is that of this, kind of say it's a Taoist type of thing of like looking at nature, and something needs to shift with the energy and change. And that's a lot of fun, actually, is seeing what is out of balance and then how do we bring it into balance. So we often talk about the 5 elements: fire, earth, metal, water, and wood, and they are a part of this whole metaphor of how the body works. In thinking of it that way, we think of the woman's uterus as the soil, and what we're doing is we're getting that earth to be nice and healthy, and the lining to be nice and healthy, lots of nutrients in there. And then we look at the cycle, and it's this cycle that actually, if you really look at it, it correlates with the moon. So some people call it getting their moon, and it's actually kind of fun if you start paying attention to the moon, and even a little extra attention to the moon. Hi moon, like really connecting with it. The cycles are able to even regulate sometimes easier into a 28-day cycle. The moon is the strongest magnetic force around us, and so it pulls out the menses and it pulls out the egg, so that we get it at that 14-day, 28-day. But it's not necessary that it has to be 28 days. Women sync up with different things. Some women sync up with different stars that are close by. Or just want to say they sync up astrologically is another way of saying it. So there's different things that pull on us, and we don't always know why. But what I work on is having that ovulation come at the halfway point, whenever that may be. So the cycle could be, let's say, 36 days. So we'd want the halfway point to be at whatever 36 divided by 2 is. 18? Okay, so day 18. And the thought with that is that at that halfway point, the uterus and then the ovaries, it's like apple trees. And so when an egg is released, it's a ripe apple coming off the tree. So if the egg becomes too soon, the apple is underripe. And if the egg is too late, it's like an overripe apple. We want the apple to be just the right ripeness, and that is what allows the conception to happen the easiest. Another thing we look at is moisture in the body, which in Chinese medicine we talk about someone being blood deficient or having enough blood. When there's enough blood, that's like the rivers flowing through the soil. There's enough nourishment to get to the lining. There's enough nourishment coming up to the skin, so the skin isn't dry. So we look at dryness. It can also be vaginal dryness, and it can be looking at the mucus that actually has a purpose at the time of ovulation. We're not taught about that in sex ed, that actually is supposed to happen. But what that is that is what the sperm swim up. So if there's no mucus coming down, the sperm kind of like, they don't have anything to swim up. So we actually have a formula, Women's Journey, which in China is known as a beauty formula, because it helps the skin to be nice and moistened and supple, and for dryness and not enough cervical fluid, this is the formula that works for that. It's a pretty awesome formula. Just a quick little story. In China, I saw them cook this up in a big pot, and all the women in my program got a jar of it because it's just a beauty formula anyway. I got I had my jar, and when I was going through the airport at the gate thing, they thought that, you know, it was a liquid, and there's these Chinese women there, and I said, no, 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 Wenjing Tong. They go, oh, beauty formula. And they said, okay, take it, take it, take it. So I snuck through with my Wenjing Tong. So let's see what else. So the steps that we work on are first conception, you know, having conception happen. And that is, we say we're working on fertility, and we say usually 3 months is how long it takes for us to get the hormones in balance. Sometimes longer, sometimes quicker, but I like to say let's give it the 3 months. And then after that, then we work on a healthy pregnancy. The goal isn't just to get pregnant. The goal is for the pregnancy to be really healthy also. So the baby's getting lots of good nutrients and blood flow, and it helps all of the baby's organs to grow in a healthy way. And then leading up to the birth, we can help the birth to come on time. People often don't realize that first births are typically 2 weeks late, but when someone's coming for acupuncture, an on-time birth is what we end up seeing, which is really appreciated by women when they're getting, you know, a little awkward and not comfortable anymore. And it's a way to prevent, you know, having to have a C-section too, because the Western world starts getting panicked and we got to plan the C-section. But so inducing I do all the time. It's a lot of fun. And then to have energy once the baby comes. When a woman is having acupuncture throughout the birth, we see less postpartum blues because we've been keeping the energy flowing and keeping the chi up throughout the pregnancy. Acupuncture is also excellent for lactation. People don't often know that, but you know, there's a lot of stress after the baby comes, all this new routine, not getting enough sleep, all these things. But having a mom come in, everything relaxes, the milk lets down, and we get good results with that. Babies that have had their moms getting acupuncture leading up to conception, and then during the pregnancy, we see that they have these bright eyes. They've been getting so much good energy throughout the whole process. I don't have a study in my head, but we see less of what we call like the trio of ADD, allergies, and eczema. They usually go as like a 3 thing together, but when the mom's been doing all this good work throughout the pregnancy, the baby's getting all these nutrients, the brain develops well, so that works out a lot better too. So that's all good news. Trying to think. Okay, so another background with Chinese medicine is that the health of a person has a lot to do with how their mom's health was before the conception even happens. So that's what we're working on. The health of the actual conception, the health of the pregnancy, the state of affairs at the birth are what we call what creates the prenatal jing, the pre-birth essence of a person. Those are the factors that are related to that. And so those are all things that we're working on. So there's a lot that we're creating to create the healthiest situation possible for mom and baby and dad, because when everyone's happy, dad can be happier too. So let's talk about some of these great building blocks that we have here. We start with a prenatal multivitamin, and I'm actually out of that at the moment, so I don't have that sample. Then we add to it the dongguai and peony formula. And when I was in China, this was the formula that he was just like, fertility formula. This is the formula. It helps with circulation to the uterus, and then things start regulating with this formula. Then we add to that the ginseng and royal jelly. Royal jelly is the what the worker bees make for the queen bee to make her as fertile as possible. So there's an energy of this, of fertility. And then we add in the 5 ancestor pills. And this is actually for both men and women. And I should mention that I recommend that the dad come in also, because this helps the DNA to sync up better when both are getting acupuncture. So even if it's just one treatment, but the more treatments, the more syncing becomes easier also. Sometimes the dad doesn't end up coming in, and we just work, full gung-ho on just future mom, but when the dad can come in, it helps. It really helps. And so this is a formula that the man can take also, because it makes the eggs as healthy as possible, and it makes the sperm as healthy as possible. It makes both seeds as healthy as possible, and this is a formula made up of seeds, because the energy of the seeds then helps with our own seeds. Then we have the B complex, and with this, when this becomes most important is once conception happens, 1 a day of this helps the morning sickness to go away. But if someone's B deficient, this is the formula that can be added. The fish oil, very excellent quality fish oil, and all of this can also be ordered through our website. Fish oil is the building blocks, the omega-3s in the fish oil are the building blocks to progesterone and estrogen. So sometimes the body just doesn't have the building blocks to make enough also. So we're putting a lot of building blocks in with these formulas. Now we have our folic acid, and what we use is, this is like the super powered prenatal folic acid. Some people have a gene that doesn't allow them to absorb folic acid, and so methylfolate is the step before folic acid, so everyone can absorb this. It's a chewable 1 a day. And B12 and folic acid are essential for the early dividing egg. If they're not there, the egg can't divide. So we have women start on this beforehand, because that helps the body to start knowing how to absorb it. So it's time to start learning how to absorb these, because if a woman just starts taking this when she thinks she might be pregnant, the body might not be used to absorbing it yet. Then we also add in herbal formulas to regulate the cycle, and we have those all over here. So each part of the cycle has a different formula, and let me just grab these here. So when we're looking at the cycle, if the first half is too short, we'll add a certain herbal formula. If the first half is too long, we'll add a different one. I have experience with, if a woman's not getting a period at all, we just do these when I have them look at the moon and sync up with the moon, and just take the herbs when it should be happening. And then we see that things just start happening, because we're telling the body what to do with the nutrients to do it. And that's the great thing with all of these herbal formulas and acupuncture, is that there's no harmful side effects. What ends up happening more is the body is getting all these nutrients that it may have been deficient in. The woman just starts feeling more energy, happier, because things are getting in balance. Another formula that I grabbed is, let's see, phlegm transforming, and this is when we're working on that there might be some accumulation of of what we call phlegm, but it's not literal phlegm. It's, cysts or other types of stagnation in the area. We also look at something that Western medicine doesn't look at, which is called cold in the uterus. From sitting on the side of a pool growing up or on the snow, but right on cold surface, right into the uterus, the little blood vessels kind of do that, and then there isn't enough circulation. So take-home homework of moxa is what we do. And in the treatment rooms, we have heat lamps and we have far-infrared mats to simulate moxa, but doing this at home kicks it up a notch of doing moxa over the area. And we have another technique also, is the way to get the little blood vessels to open again. It's all very literal, very physical what we're doing. It's very tangible to think of, warming the area. Another thing that we look at also is the uterus in a good position? Western medicine's like, it's tilted, no big deal, or it's this or that, and we're like, oh, wait a second, that means it's getting pressed on by the intestines. Let's do abdominal massage because it's like a tightly packed suitcase. Let's get that uterus to get lots of nice room and circulation, and that helps cramping for periods to go away because it has free movement to release the blood, but it also, and the lining, but it also helps once the pregnancy happens because the baby can stretch out easier and be in a nice comfortable position. It also helps with the birth itself because it's not, the uterus isn't some weird position and then it's trying to push the baby out in that weird, I shouldn't say weird, but not ideal position. So those are the main things that just come to mind at the moment. I also work with men. If there are things like, if sperm, quantity, quality issues going on, or, potency issues, we have herbal formulas for that also. So are there any questions so far? Okay, so another part I would just mention is that we also add herbal formulas to balance the individual, because I was talking about like kind of balancing the hormones, but I look at what does the individual need to bring themselves into balance. Are there sleep problems going on, thyroid problems going on? We look at what is creating those so that we, by having good sleep, good digestion, and balancing the yin and the yang in the body, that creates the ideal situation for fertility also. The protocol with the acupuncture is once a week until conception, and then once conception has happened, then once a week for the first trimester, because that's when we want to just keep holding, and help prevent the nausea also. Once we get past the first trimester, most women choose to continue at once a week, but it does have flexibility at that point of being somewhere between once a week and once a month until we get to week 36. And at week 36, 4 weeks before the birth, we go back to once a week, and then the week 39, we do daily to just tell the baby, okay, it's time now. The baby will not come before he or she is ready. The baby knows when they're ready, and when they're ready, just right there on the treatment table, we'll start seeing the contractions happening, and it's a pretty exciting thing. So, but I've never had anyone deliver in any of our treatment rooms yet. So I will wrap up and just say that that please make an appointment and we can set up a time to go over your health history. And thank you for listening. Thank you.